المحاضرة الثانية عن principles of investigation and diagnosis in orthopedics. And this is a simple and quick lecture. In general, once you do history, thorough history and good physical examination, you'll be able to formulate a good differential diagnosis. However, sometimes you need to confirm your diagnosis with some other investigations. So investigation can be radiological or laboratory. So the radiographic investigations, there is usually a non-invasive, simple, almost needed in most of cases, can give you a quick answer. So there's X-ray, CT scan, MRI, bone scan. Simpler form of imaging in orthopedics is plain X-rays. Usually, you should image the whole bone. Make sure you get two orthogonal views. Orthogonal means 90 degrees to each other. And then you should check a joint above and a joint below. CT scan, not usually required because it's more advanced. However, it's needed with complicated fractures like the pelvis, intra-articular fractures, or if there is risk, or if there is concern about tumors or infection, to better visualize the bone in more than the plain AP and lateral views. MRI, with MRI there is no radiation. However, it is usually difficult to do because it takes time, creates a lot of noise, and usually there is not a lot of machines in the hospital. So most of the hospitals will have one or two machines. So usually taking in an MRI appointment is very difficult and takes long time. However, MRI is very helpful imaging technology. It's better for soft tissue. There is no radiation because it depends on the magnetic field. It's very good for ligamental injury cases, tumors, to assess soft tissue, and also infection. Bone scan is used for screening for skeletal lesions and also can be helpful in case of tumor and infection. So the patient will receive radioactive material, and then after a period of time, it will be circulating in the body, and you can take images in different phases. So there is early phases and then phases in between. So early phases can be used for soft tissue, late phases can be used for bone. It's just a time it takes the body to absorb this radioactive material. Non-radiographic testing, including blood, biopsy, aspiration, and scoping. So for blood, common lab tests include CBC, check the hemoglobin level, WBCs, and the WBCs are very important to diagnose infection and also see what's the percentage of neutrophils. ESR and CRP are very important to assess patients with infection. And in some cases, you're required to do blood cultures to assess infection better and also obtain an organism to deal with. Biopsy, usually it's used when there is tumor or infection. Usually it's done under the supervision of the orthopedic surgeon because there is special rules and ways to be biased, especially if you are concerned about the tumors. So usually should be done under a complete aseptic technique. There should be pre-biopsy planning with imaging, and most of the time it can be done under CT or ultrasound guided by the intervention radiologists. Aspiration of joints, usually good for infection and also in some cases of malignancy. So the same thing, aseptic technique, orthopedic supervision. You can do it either in the clinic or in the emergency room or in the OR. It depends on, what's the purpose of doing the aspiration, but most of the time this can be done as outpatient setting. Arthroscopy, although it's more of a surgical procedure than an investigation, however, it can be diagnostic and sometimes. So the idea is to pass a camera and some tools into the joint to have direct visualization of the structures without opening the joint itself. So it's good to assess the intra-articular structures for diagnostic purpose, and most of the time we can perform some therapeutic procedures. So a quick summary. So investigation usually starts with imaging. The simplest form of imaging is X-rays, and then CT scan is better to assess bony structures. MRI is also good if you're having soft tissue injuries or infection. Bone and gallium is good, or bone scan is good also for looking for tumor or infection, especially if you want to screen the whole body without knowing exactly where these lesions are, because you inject the patient and then you take a full picture of the patient and then you will see where the lesion is lighting up. For the labs, CBC is the basic, lab in most cases. ESR CRP is good to assess for infection. More invasive techniques include aspirating joints, taking biopsies from the lesions, and this usually should be done under aseptic techniques. Any question?
واضح يا دكتور، الله يعطيك العافية.
المحاضرة الثانية خلصناها.
لا أنت دكتور.
تاخذون بريك قبل التوتوريال ولا نكمل عليه؟